Hi, I'm Dr. Dan Rubin, here with my associate and resident physician, Dr. Adam Kozin.
Hello.
We're here to talk about something that's really big in the news lately, and it's called belly fat. The thing about belly fat is that it's not just the fat that you can pinch right here. The more serious type of belly fat, the one that could create a predisposition for a chronic disease, is called visceral fat. Visceral fat is, well, tell us a little bit about visceral fat and why is it important?
Visceral fat, your abdominal fat lays above the muscle. Visceral fat is found below the muscle, so you can't really see it. You don't know how much you have just by examining someone.
It's a hidden danger.
Yeah, and it surrounds your organs, your internal organs, and can compress them. So, any person's around right now, we don't actually know how much visceral fat they have just by looking at them.
So this is an important point. Because just because you exercise and you might be losing weight or you might be losing fat doesn't necessarily mean that you're losing fat in the right place. So the most important thing that we can do for people is to measure that visceral fat. How do we measure it?
Well, we have an InBody 570 at the clinic here, which does measure patients' visceral fat. And that's very handy to clinicians such as ourselves, because then we can evaluate that and see if patients are making progress and losing that visceral fat.
Absolutely.
Decreasing the risk of developing numerous diseases that the literature shows.
It's a way to see if the exercise plan that you're on is actually correct for you. Some people may need more of a strength training approach, and some people may have a better fat loss when it comes to cardio. It also might mean that the diet that you may think is healthy may not be healthy for you. Or it might just be that you need a little bit of a lifestyle modification altogether.
Yeah.
Dr. Kozin, what are some of the chronic diseases that are associated with increased visceral fat?
So cardiovascular disease, higher visceral fat puts you at risk to develop a cardiovascular disease. That includes stroke, heart attack, other diseases such as diabetes it predisposes you to.
What about Alzheimer's?
Alzheimer's and dementia, that has to do kind of with, so visceral fat can actually increase your insulin resistance. So that plays into diabetes, but also Alzheimer's and dementia as well. And then specifically at this clinic, we look at it because higher visceral fat puts you at risk for developing breast cancer and colorectal cancer.
These are some diseases associated with lifestyle in some instances. So the InBody machine that we have is a unit. You can take the test with your clothes on. You just take your shoes off and your socks off, because we have 4 contact points. And how long does the test take?
Around 2 minutes for a full, from standing on it to when you print out a report showing you how much visceral fat you have.
Yeah, and you get the results same day, right then. So if you're concerned about your fat or you want to get it measured, which we encourage everybody to do, come see us at Naturopathic Specialists here in Scottsdale, Arizona. www.listenandcare.com.